चलो differential diagnosis. Differential diagnosis is very important in postgraduate examination. My patient is having kwashiorkor. There is no differential diagnosis. I know this is kwashiorkor. नहीं चलेगा. Nephrotic syndrome. I know it is nephrotic syndrome. No differential diagnosis. नहीं चलेगा. Down syndrome. I know this is Down syndrome. There is no differential diagnosis. नहीं चलेगा. Every long case or short case or in our clinical practice, we have to mention differential diagnosis. Even in all children admitted in our hospital, when you write case history, we must write differential diagnosis in black and white. Writing differential diagnosis or considering differential diagnosis is important, as history, clinical examination is important. Next step is differential diagnosis. Once you know the differential diagnosis, right from presenting complaints to history of present illness, past illness, family history, antenatal, natal, postnatal, in clinical examination, you have to rule out points in differential diagnosis. On examination, you should present the case ruling out or confirming the first diagnosis in differential diagnosis list. Differential diagnosis, whatever is your provisional diagnosis, first to mention in differential diagnosis is that. Then, according to history and examination, last to mention is to just to rule out. Complications of any disease. Rule out the complication. So it is a rheumatic fever without CCF, without seborrheic bacterial endocarditis, without pulmonary long-term valvular damage. Nephrotic syndrome. Nephrotic syndrome without hypertension. Nephrotic syndrome without recurrence, without relapse, in remission, frequent relapse, all this comes in differential diagnosis. So, whenever you see any patient or take long case, you have to mention at least 2, 3, 4, 5, whatever it is, as far as you can think, a list of differential diagnosis. Maximum possibility number 1 and minimum possibility is last. That's how we have to organize it and present it in that fashion. So it becomes, even in laboratory investigations, lab investigations to confirm the diagnosis, to rule out number 2, number 3, number 4 in differential diagnosis. So that's how we have to go. and differential diagnosis, unless you study differential diagnosis system properly, I don't think you can become a good postgraduate doctor. Thank you.